So hello everyone. Let's talk about our next question. So our next question is a 60 years old male patient has an antral carcinoma. So this is the antral carcinoma of stomach and that has spread it into head of the pancreas, right? So the cancer has spread to the head of the pancreas and also there is evidence of multiple small metastases to the right lobe of liver. Okay. Now they are asking regarding the best treatment approach to us. So the options are option A, that is Whipple surgery, option B, gastrectomy with a right lobectomy, option C, that is your gastrojejunostomy, and option D, that is your palliative care, right? So let's try to understand this question. So that 60 years male patient, he has been suffering from the stomach carcinoma and that has spread already to pancreas, head of the pancreas and the liver. Now, regarding the antral carcinomas, the thing is that in this patient, there is a local spread that happened specifically to the head of the pancreas, and also we have multiple liver metastases that is also there. So, from that clinical instances, what we can get is that it's a patient with a stage 4 of stage 4 of stomach cancer, and that stage 4 is mainly due to the distant metastasis and that is your liver involvement. Okay, liver involvement. But the thing is that in this case, the curative intent of the treatment or the curative surgery is not possible. Okay, why? Because let's try to understand, the patient had multiple small metastases. So even you are going to try to remove that small metastatic deposit in the liver by doing the lobectomy, and the possibility is there, like you are not able to clear the all the cancerous growth in that or the cancerous deposit from the liver. So that's why the curative intent is basically not possible. Okay, so that's why our main goal to treat such patient is to provide some palliative care. Now we need to understand, like during the palliative care, what do we want to give the patient or what do we have to offer the patient, right? So during that case, obviously it's a best option in this scenario. Now the goal for us is that, first of all, ensure the quality of life. So by providing the palliative care, we do not want to lengthen the lifespan of the patient, right? Our main goal is to, whatever lifetime the patient got, he or she must have some quality of life. That means your pain-free, symptomless time. So that is going to be the important, like the pain obstruction. That are the thing we need to palliate in such cases. So that's why it's the best option scenario in that case. And apart from that, you have to provide the supportive care. Supportive care. So these are the things that is important. Okay. Now let's try to understand what are the other option that has been given in this question. So other option number 1 is a Whipple surgery. So your Whipple surgery means it is known as pancreaticoduodenectomy. So while doing that Whipple surgery, we have to remove the part of the duodenum with the head of the pancreas and to some extent the part of the stomach and the terminal part of the CVT. So the part of the stomach means it's mostly the pylorus area what we have to remove, and followed by we have to provide 3 anastomosis. Okay, it's a hepaticojejunostomy, pancreaticojejunostomy and gastrojejunostomy. So these 3 anastomosis has been done following the resection in case of Whipple surgery. And this Whipple surgery is basically classically performed in a case of periampullary carcinoma when it is a resectable one. So your periampullary means your pancreatic head, duodenum and the distal CBD. Now it's not a very common thing or a very common procedure where we basically do in the background of the stomach carcinoma with this operation. Okay, so this Whipple surgery is not very much common in that respect, but you have to understand also the presence of liver metastasis makes the disease too much advanced to go for curative dissection. Even if we try to go for the curative dissection, in that case it will be of no value right? It will be of no value, because until and unless you are able to clear the all possible metastatic deposit from the patient body, it's not going to be effective one. Then your next option is gastrectomy with a right lobectomy. So let's try to understand. It basically involves removal of the affected part of the stomach, followed by you have to remove the right lobectomy, means right lobe of the liver. Okay. So suppose the patient has been suffering from the right sided liver metastatic deposit. So if you can do the right lobectomy, that will eventually get your all problems done. Okay, but this will not going to happen in such cases because there is a multiple deposit, so that's why it's going to be the problem. Okay, now only appreciate when the metastases are basically limited and resectable. So obviously it always potential for the long term survival, so that's why it is not pretty much possible in that case, and it will not going to give you a significant survival benefit in that case. Okay, and eventually the morbidity is also high. Now in case of gastrojejunostomy, this is basically a palliative procedure which we would like to do in a patient suffering from the gastric outlet obstruction. Okay, so we have to bypass that outlet obstruction area so that the food particles from the stomach will easily pass into the duodenum. Okay, just to bypass it. Okay, so it's also basically a part of the palliative procedure. Sometimes this kind of procedure eventually may relieve the symptoms that the patient comes to us with, and it will never going to interfere in the overall prognosis and the survival of the patient in that case. Okay, now in presence of the liver metastasis and the pancreatic involvement, this is not going to be the best comprehensive approach in this patient as well. So obviously you guys can easily able to understand why Whipples or gastrectomy with a right lobectomy and the gastrojejunostomy would not be a good option in such cases. So obviously your answer would be palliative care. Okay.